Paul Hunter. He's an epidemiologist and professor of medicine at the University of East Anglia and joining us from Norwich in the UK. Professor Hunter, always good to have you on the show, sir. So first of all, I mean, what went wrong with the American approach to this pandemic?
I think what went wrong was their inability to control case numbers. You look at certainly in the last 6 months of last year, there was very little change in the case fatality rates. So it was largely down to rather more cases than they should have had in the US, given that they are a country with substantial resources.
And those resources were perhaps misplaced when you had all the political infighting. I mean, the fact that they can't even, still now perhaps for some people, can't decide whether to wear masks or not is quite incredible.
Yes, it is. And it's sad that it actually became a political football, because public health imperatives aren't political. They are driven by evidence. And I think what we saw in the US was actually a very big polarization between, largely driven by politics, about whether you believed that COVID was real or not, whether you believed that what you should do to control COVID was good advice or was merely an attempt to undermine your civic liberties. And that is very sad, because as a result of that, we have actually seen such a very large death rate in the US and case rate. And as you say, it is going to continue for some time. I mean, there have been some worthwhile indicators over the last few weeks that the death rate is coming down faster than you would have predicted from the reduction in case numbers, almost certainly because of vaccinating older age groups. So it's not all bleak. Things in the future do look better, but it's still a very large number of cases and deaths that are occurring across the US at the moment.
And Professor Hunter, you will have seen, I think, the reporting from Johns Hopkins saying, by one scientist in particular, saying that the US may have actually reached herd immunity insofar as they've got to the relevant amount of people who've had the disease for the case numbers to be coming down. How much credence do you give that?
Not much credence at all, actually. One of the key things about herd immunity is that once you've had the infection, and once you've been vaccinated, you are no longer at risk of getting the infection. We know actually that that's not true. People who've had the infection can and do get reinfected and can and are infectious to others. So when we have that, herd immunity is just is impossible. And it is sad that people from reputable institutions are still talking about herd immunity when the primary requirements of herd immunity are obviously not achievable.
Absolutely. And finally then, Professor Hunter, in a really tragic way, do you think that people in your profession will take lessons from what's happened in the American context, and perhaps when the next pandemic comes around will know what not to do?
Well, I think, to be fair, I think people in my profession, infectious disease epidemiologists like myself, they have always had a reasonably good idea. It's not that we knew everything at the beginning, but we had a good idea of what the sort of things you needed to do to control the epidemic. I think the issue has always been trying to persuade the politicians of that soon enough to achieve what was necessary. And I think the lessons really are that we need to actually work better with the politicians in future to actually ensure that the evidence, and indeed the uncertainty about the evidence, where we don't know necessarily know everything, is got across in a way that is more convincing to both to the public as a whole and to politicians in particular.
Well, if that's a lesson that does come out of this, that will be something at least. Professor Hunter, thank you very much for your time.